Imagine a high-performance engine, perfectly tuned, but the fuel line is pinched. The whole system chokes. That is exactly what happens to a highly skilled medical clinic when the front desk intake process breaks down. Revenue leaks typically occur at the point of contact, the busy signals and hold times that frustrate patients before they even see a doctor. To see where the drop-off happens, look at this funnel chart of incoming clinic inquiries. We see a clear, immediate split right here at the top. 1 in 3 potential patients drops out completely because they called during peak hours and couldn't get through, or they tried to book while the clinic was closed. Further down the funnel, the losses compound. Up to 20% of the patients who actually make it onto the calendar end up as no-shows, often because manual phone reminders are inconsistent or easily ignored. Front desk burnout is frequently a symptom of the manual calendar work and repetitive phone calls that dominate a receptionist's day, leaving them with little time for patient care. This is where Zeserv comes in. It's a clinic assistant built natively on WhatsApp, designed specifically to automate away this exact operational friction. Recovering that lost revenue requires a structural shift, moving the high-volume administrative load to an automated 24/7 system. Patients today operate on their own schedules. They prefer texting over calling, and they often avoid the friction of downloading yet another dedicated patient portal app they'll only use twice a year. The traditional model forces them to navigate clunky website logins, wait on hold to speak to a human, and repeat their details while a receptionist types them out. Zeserv removes those steps by turning your clinic's existing phone number into a smart booking engine right inside WhatsApp. The immediate outcome is speed. Patients can request a specific time slot, pick their department, and answer standard intake questions in a matter of seconds, all without ever leaving their favorite messaging app. Because it is software, it doesn't clock out. When the physical clinic closes at 6 p.m., the WhatsApp assistant keeps running, capturing the off-hours revenue that would otherwise go to a competitor. There is a trade-off here. Automated text prompts handle the initial intake, which streamlines the process but limits the human small talk at the very start of the patient journey. However, that efficiency gives you a massive advantage. You remain available 24/7, capturing a patient's intent to book the moment they decide they need care. Booking a haircut is just about time. Booking a medical appointment is much more complex because you have to coordinate physical assets along with the schedule. To manage this, Zeserv relies on a back-end engine called the Conflict-Free Asset Scheduler, which is built to prevent overlapping chaos. Look at this logic tree to see how it works in practice. When an incoming patient request asks for an ultrasound, the system simultaneously checks and locks in 3 separate variables: the specific doctor's availability, the specific treatment room, and the ultrasound machine itself. As the diagram shifts to show parallel timelines, you can see how it handles parallel capacity. If a clinic can run multiple IV drips at once, the system stacks those appointments efficiently without double booking the constrained resources. That handles the back end, but on the patient side, people don't use strict booking syntax. They type casual messages, like, "Can I come in tomorrow morning?" Zeserv uses natural language parsing to read those casual phrases, automatically extracting the date, time, and intent from a message like "next Tuesday at 4." Instead of a receptionist reading the message and manually typing the details into a calendar, the AI presents a pre-filled booking form. The staff just reviews it and clicks confirm. The trade-off for your staff is a shift in their daily focus. Receptionists move from manual data entry to acting as the final approvers of AI-generated schedules. By automating the resource coordination and the data entry, you turn the front desk from a chaotic, ringing switchboard into a streamlined, error-free command post. A major operational bottleneck occurs when a clinic's primary phone number is tied to a single physical desk. If that person is busy, communication stops. Zeserv solves this with a collaborative clinic inbox. It allows multiple staff members, reception, billing, and nursing, to manage the exact same clinic WhatsApp number simultaneously from their own stations. This flowchart details how the system increases efficiency. A single centralized WhatsApp inbox automatically reads incoming messages and sorts them into distinct pipelines. General bookings go to reception, invoice questions are routed to billing, and medical queries reach the nursing staff directly. Implementing this shared inbox requires some upfront work. Your team will need to coordinate and establish rules on which department handles which types of queries to ensure the routing works correctly. Consider the doctors and medical directors. They are often on the move and are rarely sitting in front of the main desktop software. Zeserv acts as a mobile command column. A doctor can simply open WhatsApp, text the word "today" to their own clinic's number, and instantly receive their upcoming patient list and end-of-day summary right in the chat. By decentralizing access, the entire team gets immediate visibility into the patient pipeline directly from their phones, completely bypassing the busy receptionist desk. A patient's journey and the associated revenue opportunities continue after they walk out of your clinic doors. Immediately after checkout, the system can deploy tailored recovery instructions and follow-up care reminders to the patient's WhatsApp. It also includes an automated review collection mechanism. Driving consistent feedback directly impacts your clinic's local Google search rankings, which helps bring in new business. Beyond individual follow-ups, it includes broadcast capabilities. You can send health alerts, holiday hours, or wellness camp invites to your entire patient database, complete with live response tracking. This requires a brief time investment at the start to customize the care instructions and broadcast templates for your specific practice. Once established, these follow-ups become a consistent operational standard, ensuring every patient receives the same level of post-visit engagement, regardless of how busy the front desk is. When you compare the speed of WhatsApp automation against the limitations of traditional phone calls and patient portals, the impact on your capture rate is clear. Looking at this matrix, the return on investment maps out clearly. You reduce no-shows through automated reminders, recapture off-hours revenue through the 24/7 bot, and save your staff hours of manual confirmation work. This system is specifically effective for high-volume modern clinics, medical directors looking to stop revenue leaks, and operations managers focused on reducing staff workload. However, if your practice caters exclusively to a demographic that does not use digital communication, or if your clinic chooses not to utilize WhatsApp for business operations, this platform won't be a fit. Ultimately, Zeserv shifts the administrative burden off your reception desk and onto a system that lives exactly where your patients already spend their time. Meeting patients on WhatsApp is a frictionless way to run a modern clinic, build instant trust, and ensure no booking opportunity is missed. Book a demo today to see how it works for your practice.